Be prepared to manage complications in a pre-hospital setting. Common complications include nuchal cord, meconium staining, prolapsed cord, and breech presentations. A nuchal cord occurs when the umbilical cord is wrapped around the infant's neck. Delivery of the infant cannot continue without the cord tightening around the baby's neck.
So basically, when you deliver the head, you're going to want to look or feel around the neck to see if you can discern whether or not there's cord there. If there is cord there, you just want to hold some manual pressure on the head, keep the baby from coming out any further, slip a finger under the loop of cord, and just slip it over the baby's head.
If the infant expels stool in the amniotic fluid, it is referred to as meconium staining. The risk is that the baby could aspirate meconium into the mouth and lungs, which leads to respiratory problems. You may encounter other complications that require immediate, rapid transport. If the umbilical cord is the first presenting part during delivery, it is referred to as a prolapsed cord. As the head delivers, it squeezes the cord against the vaginal wall, cutting off circulation to the baby.
So basically, the provider's job is to get as much pressure off the cord as you can. So if you feel the cord and you can't feel any pulse, which is what you should normally feel, then there's too much pressure. And so they recommend having mom in a knee-chest position. The unfortunate part about that, and I can say this having been 9 months pregnant, the knee-chest position isn't something that you're going to get mom into easily. It's very cumbersome. So be creative. Try and get the hips as high as you can because that will help the pressure of the head ease from the cord. You may need to glove and actually put a couple fingers inside to try and push the baby's head off the cord itself, or even if you can't actually push the head up in a way, maybe pushing against the wall of the birth canal so that you can make some space for the cord. And you'll know you're successful if when you feel the cord, you're able to palpate a pulse, and that's when you know you've done what you need to do.
With a prolapsed cord, rapid transport is your best option. When a baby is positioned so that the head will deliver last, it is called a breech presentation. There are several types of breech presentations. When an infant is positioned buttocks first, with legs extended, this is called a frank breech. During a complete breech, the infant is buttocks first and the knees are flexed. A feet first position is called an incomplete or footling breech. Most pre-hospital protocols do not recommend trying to deliver a breech presentation in the field. If you recognize a baby in breech position, focus on rapid transport, guiding delivery as far as possible, and keeping the patient calm. Always seek medical direction for complications occurring during or after labor and delivery. Make sure you contact the receiving facility early to advise them of the situation. Keep in mind that your calm attitude and approach will have a positive influence on your pregnant patient.
For the most part, mom will be able to do most of the work. You're just going to assist, and if you know how this is to occur normally, then when it's not occurring normally, then you're going to be able to catch that and hopefully intervene and stop anything significant from happening.